Chapter 2. Medical Terminology. Chapter 2. Cheat Sheet. Let's look at our Chapter 2 cheat sheet. Think of medical terms like a puzzle with 4 simple pieces. First, we have the prefix at the beginning, which tells us the location or time. Second is the root, showing the main organ involved. Third is the suffix at the end, which describes the action or condition. And finally, the vowel O acts as the glue to connect these words together smoothly. Let's put it together. For example, peri plus cardi plus itis creates pericarditis. Make sure to take a screenshot of this page right now before we move on. Next, let's talk about surgical abbreviations. You will see these on the schedule every single day, so they are critical for SPD reception. ORIF stands for Open Reduction Internal Fixation. CABG is coronary artery bypass graft. THA and TKA mean total hip or knee arthroplasty. And BKA or AKA stand for below or above knee amputation. Now, let's review anatomical directional terms. Don't get tricked by these on your exam. Proximal means near the point of origin, while distal means far from it. Similarly, anterior refers to the front of the body, and posterior refers to the back. Keep these straight, and you will do great. All right, it is time to test your knowledge. Welcome to the Chapter 2 mock exam. We have 24 practice questions based on the blueprint to get you ready. Grab a pen and paper. Ready? Let's begin. Question 1. In medical terminology, which of the following suffixes strictly means surgical removal? A. Ectomy. B. Oscopy. C. Otomy. D. Ostomy. Correct answer, A. Ectomy. Rationale. The suffix ectomy means excision or surgical removal. For example, an appendectomy is the surgical removal of the appendix. Otomy means cutting in two. Ostomy means creating a new opening. And oscopy means visual examination. Question 2. The root word cardi combined with the suffix itis forms carditis, which translates to inflammation of the A. liver, B. heart, C. joint, D. stomach. Correct answer, B. heart. Rationale. The root word cardi refers to the heart. The suffix itis indicates inflammation. Therefore, carditis is the inflammation of the heart. EPOP refers to the liver, arthur to a joint, and gaster to the stomach. Question 3. What is the most common combining vowel used in medical terminology to smoothly link a root word to a suffix? A. B, E, C, A, E, C, O, D, I. Clo. Correct answer, B, O. Rationale. O is the most frequently used combining vowel in medical terms. It has no meaning of its own, but is used to make the terminology easier to pronounce, for example, hematology. Question 4. The prefix peri, in words like periosteal, referring to a surgical elevator instrument means a through, B. under, C. inside, D. around. Correct answer, D. around. Rationale. The prefix peri means around or about. A periostyle elevator is an instrument used to strip tissue around the bone. Through is dia, under is sub, and inside is endo. Question 5. A surgical procedure designed to create a new artificial opening into the colon is properly documented as a colectomy. B. Colonoscopy. C. Colostomy. D. Colotomy. Correct answer. C. Colostomy. Rationale. The suffix ostomy refers to creating a new opening, a stoma. Thus, a colostomy is creating an opening into the colon. A colotomy is removal, and a colotomy is simply making an incision into the colon. Question 6. The common surgical abbreviation ORIF specifically relates to a procedure associated with A. Fixing a fractured bone. B. Removing the gallbladder. C. Repairing an abdominal hernia. D. Treating a cardiovascular condition. Correct answer. Affixing a fractured bone. Rationale. ORIF stands for Open Reduction Internal Fixation. This is an orthopedic procedure used to surgically repair and fix a fractured bone using plates, screws, or rods. Question 7. In anatomical directional terms, which word means closer to the point of attachment or origin? A distal. B. Anterior. C. Posterior. D. Proximal. Correct answer. D. Proximal. Rationale. Proximal means closer to the point of attachment, for example. The shoulder is proximal to the elbow. Distal means farther away from the point of attachment. Anterior is front, and posterior is back. Question 8. The prefix tachy, as commonly seen in the condition tachycardia, translates directly to A. Slow, B. Fast, C. Large, D. Small. Correct answer. B. Fast. Rationale. The prefix tachy means fast or rapid. Tachycardia refers to an abnormally fast heart rate. Slow would be indicated by the prefix Brady. Question 9. The prefix inter means between, whereas the prefix intra means A. Within, B. Around, C. Outside, D. Below. Correct answer. A. Within. Rationale. In medical terminology, intra strictly means within or inside, for example. Intravenous means within a vein. Inter means between, for example. Intercostal means between the ribs. Question 10. If a surgeon is performing a procedure involving the cholecyst, they are operating on the A. Urinary bladder, B. Gallbladder, C. Liver, D. Kidney. Correct answer, B. Gallbladder. Rationale. The root word cholecyst refers specifically to the gallbladder. A common procedure processed in the SPD is a cholecystectomy removal of the gallbladder. The liver is hepat, and the kidney is nephro. Question 11. The surgical suffix -raphi strictly indicates which of the following actions? A surgical crushing, B. Surgical fixation, C. Surgical suturing, D. Surgical repair. Correct answer, C. Surgical suturing. Rationale. The suffix -raphi means surgical suturing, for example. Herniorrhaphy is the suturing of a hernia. Plasty means surgical repair, and pexy means surgical fixation. Question 12. Which of the following acronyms refers to a major cardiovascular surgical procedure? A. ORIF, B. FI, A. C. B. K. A. D. C. A. B. G. Correct answer, D. CABG. Rationale. CABG stands for coronary artery bypass graft, a major heart surgery. ORIF, open reduction internal fixation, and THA, total hip arthroplasty, are orthopedic, while BKA, below knee amputation, relates to the lower extremity. Question 13. The root word myo refers to which type of tissue in the human body? A muscle, B. bone, C. nerve, D. skin. Correct answer, a muscle. Rationale. The root myo refers to muscle. For example, the myocardium is the heart muscle. Bone is osteo, nerve is neuro, and skin is derm. Question 14. The prefix "des", as commonly used in words like dysplasia, indicates something that is A. without or absent, B. painful, difficult, or abnormal, C. excessive or above normal, D. slow or delayed. Correct answer. B. painful, difficult, or abnormal. Rationale. Des translates to bad, difficult, or painful. For example, dyspnea means difficult breathing. Without is a or and an. Excessive is hyper. Question 15. If a patient's medical report notes hepatomically, it indicates that the liver is A. hardened, B. ruptured, C. enlarged, D. inflamed. Correct answer, C. enlarged. Rationale. The suffix megaly means enlargement. Combined with the root hepat, liver, hepatsomegaly specifically means an enlarged liver. Itis would be inflammation, and sclerosis would be hardening. Question 16. The root word cervic is used in medical terminology to refer to the A. skull, B. rib cage, C. lower back, D. neck. Correct answer, D. neck. Rationale. Cervic pertains to the neck or the neck of an organ like the cervix of the uterus. For example, cervical vertebrae are the bones in the neck. Question 17. In anatomical directional terms, a structure that is located farther away from the midline of the body is described as a lateral, B. medial, C. superior, D. inferior. Correct answer, a lateral. Rationale. Lateral means to the side or away from the midline of the body. Medial means toward the midline. Superior means above, and inferior means below. Question 18. An instrument described with the suffix tome, such as a dermatome, is specifically designed to A. view or examine, B. cut or incise, C. crush or break, D. dilate or expand. Correct answer, B. cut or incise. Rationale. The suffix tome refers to an instrument used for cutting. A dermatome is an instrument used to cut thin slices of skin for grafting. Oscope is for viewing. Question 19. The surgical removal of the uterus is known as a hysterectomy because the root word hystera means A. ovaries, B. fallopian tubes, C. uterus, D. vagina. Correct answer, C. uterus. Rationale. Hyster is the medical root word for the uterus. Therefore, A hysterectomy is the excision of the uterus. The ovaries are oofer and the fallopian tubes are salping. Question 20. A surgical procedure that is performed on both sides of the body is documented as A. Unilateral, B. Contralateral, C. Ipsilateral, D. Bilateral.
Correct answer, D. Bilateral rationale. The prefix bi means two. Bilateral refers to both sides. Unilateral refers to only one side of the body.
Question 21. The suffix "cidal" as used in terms like bactericidal strictly means A. To kill or destroy, B. To stop or inhibit, C. To view or examine, D. To measure. Correct answer, A. To kill or destroy. Rationale. The suffix "cidal" means to kill. For example, a bactericidal agent kills bacteria. This is distinctly different from the suffix "static," which means to simply halt or inhibit growth without killing. Question 22. If a patient is undergoing a lithotripsy procedure, the surgical team is working to crush A. A tumor, B. Stone, C. Blood clot, D. Bone spur. Correct answer, B. Stone. Rationale. The medical root word "lith" translates to stone, often found in the gallbladder or kidneys. The suffix "tripsy" means to crush. Therefore, lithotripsy is the surgical crushing of a stone. Question 23. The prefix used to describe a medical condition that is below, under, or deficient is A. Hyper, B. Supra, C. Hypo, D. Tachy. Correct answer, C. Hypo. Rationale. Hypo means below, under, or deficient. For example, hypothermia is dangerously low body temperature. Hyper means above or excessive, and supra means above. Question 24. What is the medical term for the surgical repair or replacement of a joint procedure frequently processed in the SPD for orthopedics? A. Arthroscopy, arthrotomate arthroplasty, correct answer, D. Arthroplasty. Rationale. The root word arthro means joint, and the suffix plasty means surgical repair. Arthroplasty, such as FAR, total hip arthroplasty, refers to joint replacement repair. Arthroscopy is just viewing the joint, and arthrotomy is cutting into it. Congratulations on finishing the exam. Please share your score in the comments below. Don't forget to subscribe for Chapter 3 and join the waitlist for our 150-question simulator. Thank you for practicing with us, and good luck.